Today, we're talking about liquid diets, but probably not in the way you're thinking. Forget the trendy cleanses and detoxes. We're going to explore a much more critical question. When are these diets a prescribed medical necessity? Yeah, when you hear liquid diet, your mind probably jumps straight to something like a juice cleanse, right? Or maybe some detox that's all over social media promising quick results. But in the medical world, the purpose is completely different. You see, a medical liquid diet, well, that's a whole different ballgame. This is not a lifestyle choice. It's a serious clinical tool, something a doctor prescribes to get a very specific job done inside your digestive system. Okay, so here's our game plan. First, we're going to bust the biggest myth out there. Then we'll get into the two main types, the three key medical reasons a doctor would actually prescribe one, and finally, we'll cover the risks and rules you absolutely need to know. Let's dive in. First things first, and if you take away only one thing, let it be this: medical liquid diets are not for weight loss, period. And you know, the Cleveland Clinic puts it perfectly. They point out that this is not a weight loss diet. In fact, it's not very nutritious at all and is often just loaded with empty calories from sugar. It's a short-term tool for a specific medical problem, not a long-term plan. So to really get how these diets work, you've got to know the two main categories they fall into. You've got your clear liquids and you've got your full liquids. And the big difference here really comes down to what's left behind, what doctors call residue. A clear liquid diet is just what it sounds like, liquids you can literally see through. They pass through you, leaving almost nothing behind. A full liquid diet, on the other hand, is the next step up. It introduces things like milk or strained soup. Think of it as a bridge to get you back to eating solid food again. This is a perfect example. See this broth? You can see right through it. That's a clear liquid. And what that means is your digestive system barely has to lift a finger to process it. And that is exactly the point. Now, full liquids, they've got a little more substance. We're talking about things that are still totally smooth, no chunks, like milk, creamy soups, or plain yogurt. Even thinned out cream of weight counts. These start to gently wake up your digestive system while giving you some much-needed calories and protein. Okay, so reason number one, why would a doctor put you on one of these diets? Well, the first big reason is so they can see what's going on inside you. Just think about a colonoscopy. The whole point is for the doctor to get a good, clear view to look for things like polyps. If your digestive tract isn't totally empty, they can't see. They might miss something really important, or you might have to do the whole prep all over again, and nobody wants that. That's why a clear liquid diet is absolutely crucial. And here's a really fascinating detail. The diet itself is simple, right? Clear juices, gelatin, broth. But look at this critical rule. No red or purple stuff. Ever wonder why? It's because those artificial dyes can actually stain the lining of your colon. A doctor could see that stain, think it's blood, and that could lead to a whole world of confusion and misdiagnosis. All right, on to reason number two. This one is all about healing after surgery, especially any surgery that involves your stomach, your intestines, or even just your mouth. Let's look at something like bariatric surgery. The stomach is made much smaller, and it needs serious time to heal. You can see the progression right here. They start with clear liquids, then slowly move up to full liquids with protein shakes. It's a super slow, super careful process designed to let everything heal up without putting any stress on it from solid food. And it's not just major stomach surgery. Think about getting your wisdom teeth out. The absolute number one priority is protecting the blood clot that forms where the tooth used to be. That clot is like a natural Band-Aid. If it comes out, you get something called a dry socket. And trust me, it is incredibly painful. Which leads us to the single biggest rule of them all. No straws. Seriously. That little bit of suction you create when you use a straw is powerful enough to pull that crucial blood clot right out. It's literally the most common cause of dry socket. So you have to use a spoon, even for smoothies and shakes. Okay, our third and final reason, and honestly, this might be the most powerful one of all. Liquid diets can actually be used as a primary treatment to fight severe inflammation in your gut. There's this approach called exclusive enteral nutrition, or EEN. For 6 to 8 weeks, a patient gets all of their nutrition from a special liquid formula. And I mean all of it. It's not a side thing, it is the treatment. And it's incredibly effective at calming down severe inflammation from conditions like Crohn's disease and even sending it into remission. And how effective is it? Get this. In kids with Crohn's disease, it can induce remission in up to 85% of cases. That is a huge number. It's often even better than steroids for healing the lining of the gut. It works by basically giving the gut a total vacation and changing up the gut bacteria for the better.
And this idea of gut rest isn't just for Crohn's. A doctor might use a short-term liquid diet to calm down a nasty flare-up of diverticulitis or pancreatitis. Even for severe vomiting or diarrhea, just hitting that pause button with liquids can give your system the break it needs to heal.
So we've seen just how powerful these diets can be. But because they're a real medical intervention, they come with some serious rules and risks. And that is why you should never do this without a doctor's supervision. Yeah, this isn't just about drinking when you feel thirsty. It's way more precise than that. That bariatric surgery patient, for example, is often told to sip slowly all day long. We're talking no more than 2 ounces every 15 minutes. It's methodical, and it's to make sure they stay hydrated without overwhelming their newly sized stomach. And if you don't follow the rules, the risks are very real. First off, malnutrition. These diets just aren't safe for more than a few days without supplements. Then there's blood sugar. A lot of clear liquids like juice are packed with sugar, which is a big deal if you have diabetes. And here's the wild part. You can actually get dehydrated. If you aren't sipping constantly, you can fall behind on your fluids really easily. So when you put it all together, a medical liquid diet is so much more than a trendy cleanse. It's a prescribed pause button for your entire digestive system, a tool used to get a clear look inside, to let things heal, or to actively fight a disease. And it leaves you with a really interesting question, doesn't it? When is doing less actually the most powerful medicine of all?